A tiny tablet in your medicine cabinet can relieve pain, protect your heart, and even reduce cancer risk, but misuse can be dangerous. Yes, we're talking about aspirin. Introduction. Aspirin, or acetylsalicylic acid, is one of the most commonly used medicines worldwide. It's used for pain, fever, inflammation, and even heart health. Fun fact, it was originally derived from willow bark hundreds of years ago. How aspirin works. Aspirin blocks chemicals in the body called prostaglandins, which cause pain, swelling, and fever. By blocking them, aspirin reduces pain, inflammation, and fever. For heart health, it thins the blood, helping prevent clots, which can reduce the risk of heart attacks and strokes. Common uses. Pain relief, headaches, toothaches, muscle pain. Fever reduction, mild to moderate fevers. Inflammation, arthritis or joint pain. Heart and stroke prevention, low-dose daily use in high-risk patients, only under doctor supervision. Dosage and forms. Forms, tablets, chewable, enteric-coated. Doses. 75 mg, heart protection. 325 mg, pain or fever relief. Always follow your doctor's instructions. Overdose can be dangerous. Why not for children? Children and teenagers should avoid aspirin, especially with viral infections like flu or chickenpox. Reason 1, Reye syndrome, a rare but serious condition affecting the liver and brain. Reason 2, platelet aggregation effect. Aspirin blocks an enzyme called COX-1, which prevents platelets from forming clots properly. This increases bleeding risk, even from minor injuries. Safe alternatives for kids, acetaminophen, paracetamol, or ibuprofen, if recommended by a doctor. Side effects and risks. Common, stomach upset, heartburn. Serious. Bleeding risks, stomach, intestines, brain. Allergic reactions in some people. Interaction with other blood-thinning medicines. Tip, take with food or water to reduce stomach irritation. Latest research and studies. Colorectal cancer. Daily low-dose aspirin may reduce recurrence in colorectal cancer patients with specific genetic mutations. Patients with PI3K pathway mutations had a 55% lower risk of cancer returning when taking 160 mg daily for 3 years. Heart disease. Aspirin is valuable for secondary prevention in cardiovascular disease. The ADAPTABLE trial found 81 mg is as effective as 325 mg, with fewer side effects. For people over 60, routine aspirin for primary prevention is no longer recommended due to bleeding risks. Cancer prevention potential. Observational studies suggest aspirin may reduce risk of esophageal, gastric, and colorectal cancers, thanks to anti-inflammatory properties. More clinical trials are needed to confirm these benefits. Precautions. Consult your doctor if you have bleeding disorders, ulcers, kidney or liver problems. Avoid alcohol and other blood thinners while on aspirin. Children and teenagers should never take aspirin unless prescribed. Aspirin is powerful, but only when used correctly. It can relieve pain, protect your heart, and may even help prevent some cancers. But misuse, especially in children or older adults, can be dangerous. Always talk to your doctor before starting or stopping aspirin. Stay informed, stay healthy.